So good morning, everybody.
Good morning.
My name is Heshi Zinman, and I'm the chair of the LGBT Elder Initiative. The Elder Initiative is a volunteer-driven organization dedicated to assuring that LGBT older adults have access to LGBT culturally competent services, resources, and institutions that they need in order to age successfully at every age. Today's program, Gettin Older with HIV, is the first of our conversation series of educational forums for the fall 2014 season. Today's program is led by the Elder Initiative and is a collaborative effort with Action AIDS, the AIDS Library of Philadelphia, and Penn Medicine. Gettin Older with HIV is made possible by the generous support of Delaware Valley Legacy Fund, Penn Medicine, Philadelphia Corporation for Aging, and Philadelphia Gay News. We are especially pleased to have the support of the City of Philadelphia's AIDS Activities Coordinating Office, ACO. This is ACO's third year of supporting the Elder Initiative's effort to mark National HIV Aging and Awareness Day, and I would like to introduce Coleman Terrell of ACO and ask him to say a few words. Coleman?
Yay! Good morning, everyone, and welcome. And as Heshi said, this is the third year ACO has partnered with the Elder Initiative to mark HIV and AIDS Awareness Day. It's an event that every year has been really a wonderful event, and this year we're happy to partner again. The program today is designed to provide information and resources to help people with HIV continue to age successfully and live independently. We have expert presenters, and I want to thank them for their time. I want to thank the Getting Older with HIV Planning Committee. I want to thank the volunteers who are here today and the other sponsors and collaborators on this event, because it's a really wonderful thing to get together and learn and grow from here.
Thank you. Thanks, Coleman. So thanks again to Coleman, and thanks to ACO and all of our sponsors and community partners for their continuing support of the Elder Initiative's work. I would also like to thank all the volunteers here today and those members of the Planning Committee who helped make this program possible. We have a great program planned today that includes presentations by experts in their fields discussing key issues of importance to LGBT older adults living with HIV, their families, friends, and caregivers. Following all the presentations this morning, there will be a Q&A session with the entire panel. So please hold your questions until the presentations have been concluded. After the Q&A session, those who have brought their medications with them will have the opportunity to meet one-on-one with a pharmacist to review all of their medications and to ask medication-specific questions. Today's presenters include Wayne Marquardt, a pharmacist with Penn Medicine and a longtime community health activist, who will discuss medication safety and the importance of adherence to staying healthy. Jay Johnson and Rosemary Dahl, both of Action AIDS, will discuss the importance and challenges of staying socially connected and the resources that are available in the community to help you to maintain your independence as you get older. Our first presenter is Dr. John Stern, who is the chief of the Division of Infectious Disease at Pennsylvania Hospital. John has been treating people living with HIV since 1988, and probably before, but in Philadelphia since 1988. We are fortunate to have him here today to share his knowledge about the unique medical issues that people living with HIV/AIDS face as they get older. Please give a warm welcome to Dr. John Stern.
Thanks, Heshi. Good morning. I'm John Stern. Yeah, and I can tell you, it was 1981 that I had my first HIV patient. I was at the University of Texas, and a man developed a bizarre opportunistic infection in his brain. We sorted it out, but never really understood why he got into trouble. And after about 3 months, he developed another opportunistic infection, and then a third, and then slipped away and died. And each week at our conference, we would say, "What's this guy got? What's this guy got? You know, it must be some weird viral illness." And then within about a year, we sorted it out by 1982. And by 1983, the virus was identified. And by 1985, we had HIV serologies for identifying patients. And by about 1990, we had CD4 counts. And by 1995, we had pretty effective therapy. And I would say in our practice at Pennsylvania Hospital, where I've been since 1988, where we were losing a patient a week, we now lose a patient a year. And those patients that we lose due to just getting older. Heart disease, diabetes, strokes, cancers, and so on. But in terms of HIV and HIV mortality, if you take your medicines, your life expectancy is within 4 months of an HIV-negative person, which is quite remarkable. So I was just going to start by giving you guys a little bit of Philadelphia epidemiology of the epidemic. Let me see what we've got here. These slides are a little small for all of us, but I'll do my best. I just want to share with you that these slides were taken from Coleman's group, the AIDS coordinating activity group here in Philadelphia, ACOG, and Kathleen Brady, who is a colleague of mine. We work together. She's a part-time worker in our office, a really superb physician and a superb epidemiologist. And she was kind enough to share some of the data that she has about the epidemiology of HIV here in the city. So let me just start by telling you that there are roughly, in the data here is as of 2013, there are roughly 21,000 people in the city alone living with HIV. There are probably another 5,000, 25,000 people living with HIV in the metropolitan area in the Delaware Valley. So a pretty significant burden. And unfortunately, probably about 20% of all of the HIV burden in the community is unrecognized by those affected patients. They just don't know they're positive. And obviously, if you don't know, you're not in care. If you're not in care, you're not taking your meds. If you're not taking your meds and you're sexually active, you're going to give it to somebody. So it's the burden of untreated disease that propagates this viral illness, as we all know. The in-care data is those patients, and I won't go through the definitions of what in-care means, but it basically means you have a doctor, you're aware of your HIV status, you get your CD4 count and viral load obtained periodically, and you take your medicines. And unfortunately, less than half of the patients that are HIV positive in the city are actually in care. So we've got a huge number of people that actually know they're positive, but are walking about, and for a variety of reasons, which many of us are aware, education, finances, understanding, mental illness, alcoholism, substance abuse, lack of insurance, all of the sort of social issues that plague many people prevent folks from getting in care. And then another rather disappointing number is that even once in care, getting your viral load down to less than 200 is not all that successful. And the bottom line is that of the 25,000 people that are positive here in our metropolitan area, probably only about 30% are not only aware, are in care, are taking their meds, and have an essentially undetectable viral load. So if you just do the numbers, that's 8,000 out of 24,000, 1 in 3. This epidemic is continuing to propagate, and it propagates in this city alone at about 750 cases per year. That's a lot. And if you look nationwide, I believe the current numbers are we're faced with 54,000 new cases of HIV in the United States a year. And it's reached sort of a flat line. We're not doing any better. We just keep perking along.